I want to just give you a very brief overview of how this current pandemic affects depression. There are really two ways. One of them is the social isolation that we know is a risk factor for depression. And I think this is something that Dr. Harrington alluded to when she was talking about the elderly in nursing homes. And the second is depression that is actually caused by the virus. So in the first situation, it's not people who are actually infected, but it's individuals who, because of the virus, actually have to remain in social isolation. So the impact of social isolation can be quite devastating in many ways. The idea that you're worried about what form the illness might take and your concerns about infecting other people. The problem is particularly acute among the elderly because sometimes they might be in nursing homes where this became particularly problematic. But because the elderly are among the highest risk group for contracting the virus as well as the most severe effects, they were asked to specifically self-isolate. So this problem is very acute among this population. It is a very serious health concern because studies after studies have shown that social isolation increases your risk of cardiovascular disease, so heart attacks and strokes. It increases the symptoms of autoimmune diseases if these individuals have autoimmune diseases. And of course, it increases mental health issues, especially depression and anxiety. So what exactly does social isolation do? If you think about it, social isolation is you're not particularly affected by the virus at the time. You're simply not interacting with people. What does that do to your physiology and how is that linked to depression? So what does it do to you? It increases the levels of certain hormones like cortisol, which is a stress hormone. It weakens your immune system. People who are socially isolated tend to have a higher risk of infections, and part of it is because their immune system doesn't cope as well with any kind of passing bug, as it were. And among the elderly, this is particularly a problem because they are already disadvantaged because they have a change in their basal inflammation, as it were. So social isolation can have very dramatic impacts. And then the actual virus itself. When you get the virus, the first thought was, well, this is SARS, right? This is severe acute respiratory disorder. What we're now noticing is that there are a whole array of mental health issues that are occurring, including depression, including cognitive changes, memory changes, and people essentially feeling overwhelmed. So this is a broad basket of mental health issues. I don't know if many of you all remember the reporting of Chris Cuomo when he himself had the virus. He spoke very eloquently about the demons coming out at night. And this was the depression that the virus brings. So how does a respiratory virus, one that affects your lungs, affect your brain and your mood? And it's a very interesting connection. The route by which the virus enters your body is through your nose. And the nose is actually somewhat exposed to the brain, right? And so the virus can actually end up in the brain, especially in a particular portion called the olfactory system. And the olfactory system, which is basically how we smell things, is very, very strongly implicated with depression. So now you have a virus that can enter into the brain and affect an area that we know is implicated with depression. The other thing it does is that once you have the virus, you can have a full-blown inflammation. You have these proteins called cytokines that are going to try to actually help resolve the virus, but they do it in a sort of a slash and burn manner. They're going to start killing off cells. They're going to affect things besides just the virus-infected cells. As a result, people will experience depression because of the inflammation that occurs. You see this very often with other inflammation type diseases, such as stroke, such as other types of viral infections.